Thank you, Mr. Speaker. I firstly want to pay tribute to Margie Upper, who resigned just 4 months ahead of the end of her contract. She took on what I would describe as probably one of the most challenging roles in the New Zealand health system, and I'll talk about that in a moment. I think it's also important to inject some facts into this debate. Dr. Nicholas Jones did not resign. His secondment actually ended, and he has returned to the Hawke's Bay. And again, I want to pay tribute to him for his leadership of the National Public Health System. They are both people that have contributed to our health system. I also want to acknowledge the new Minister of Health, Simeon Brown, who I think did an excellent job of talking about this government's health priorities. And I do have to agree with something that a member of the opposition said, that Margie Upper's leadership was undermined from the very start. Yes, it was. That's what you do when you put someone into the role of combining an organisation during a pandemic. She was given an impossible task, and she did it to the best of her abilities. But when you decide to make such radical changes in the middle of a pandemic that were not well thought through, you're actually setting someone up for a very, very difficult job. And she did her best under very, very difficult circumstances. The Minister also reflected on getting rid of health targets. Well, we have a saying in ACT, and in fact in many organisations, what gets measured gets done. And when you stop measuring the public health outcomes and services that Kiwis expect, things do slip away. And we heard from the Minister a number of very unfortunate statistics that went backwards around elective surgery, immunisations, etc. under the last government. This government is here and committed to cleaning up health. And that does mean bringing in some people into new leadership roles like Professor Lester Levy, who took over as the Commissioner. But it also means tidying up some of the other messes that were left in health. One obviously very dear to my heart is Pharmac, and the massive fiscal cliff that was left in Pharmac, which would have seen medicines, many of them cancer medicines, not continue to be funded. Again, this government had to come in, clean up that mess. The Minister also made an important announcement around Dunedin Hospital last week. Again, a project that had just been left to run off the rails. Well, again, this government has delivered some certainty to the people of Dunedin, and in fact the people of the south where I'm from, and that will actually go ahead and will actually be delivered in a responsible way and in a timely way. So yes, health is very important to Kiwis, and they are not getting the health services that they expect, and that is a real shame. But we've got to completely be transparent that we've actually got to front up to these challenges, not bury them away, not try to just reorganise things, bring in more bureaucrats. We've actually got to say Kiwis deserve world-class health services supported by wonderful frontline healthcare professionals, and we have many of them, our doctors, our nurses and our other frontline staff, and that's who we're backing in to actually start to turn things around. And so it's very convenient for the opposition to just blank their minds of the mess they made in health over an extended period, but we're here to try and actually bring in some reality to that. And it was very good to see that the Minister will be continuing to focus on the 5 health areas that the government has put in place and actually measuring and making sure we're delivering against those. I do want to thank everyone in our public health system that's working very, very hard today, who worked very, very hard actually over the holiday period. We know it's tough out there, but we're here to make the tough decisions, the right decisions, and actually turn around this health system and actually have it deliver for Kiwis. Thank you.
Which is really interesting he says from South, because he's only been living in Queenstown since, I think it was something like between 8 and 12 weeks before the last election, after David Seymour headhunted him to become a politician and placed him number 4 on the list.
Oh, God.
Does this guy Sue's Redmayne too?
Yeah.
Because it's kind of what he's like. He's just another glad hander. I mean, he's just a cheerleader.
I've dealt with him on fleet committees. He ain't this bad. I found him always quite pleasant to deal with because he's about fact-finding. He doesn't sit there and rabbit on about talking points, which is quite strange for an ACT person, but he does have a bit of experience that's a bit... He has a bit more of a social conscience than the average ACT person. But this speech did feel very ACT. And like the Dunedin Hospital was just basically an absolute debacle of, let's sit there and change this. We've realised that we got to keep doing what we're doing.
Yeah, I mean, look, there's no shortage of people that want to train to be doctors and nurses here in New Zealand. When you've got like notices coming out of India saying, hey, nurses that want to move to New Zealand from India, don't move there unless you've got a genuine job offer. You've got nurses that aren't getting jobs, that are getting qualified and there's no job for them, even though there's a high demand for them. There's, again...
so much for the front line.
Yes,
exactly. I mean, as you mentioned earlier, like getting rid of the NCOs, it's like, next Simeon Brown will be Minister of Defence. For the NCOs, remove the rank from warrant officer right down to corporal. So basically, you go from private, and the next person up is warrant officer class 1. Or if it's the Army or if it's the Air Force, it's warrant officer. And I can't remember what the Navy equivalent is. But, is it going to do that? And say if it's on the officer side, are we suddenly going to have second lieutenants, and the next thing we have is, what do you call it? Was it captain, major? What's it called? Major? Brigadier?
Lieutenant Colonel, Brigadier.
Yeah. I know the Air Force one's better because I did HEC. So, are we just going to have a bunch of pilot officers, no flying officers, no flight lieutenants, no squadron leaders, and then we're just going to go to wing commanders?
Yeah.
Well, I mean, listen, again, one of the things, I was reading through the reports, again, I was from the New Zealand Medical Journal, and one of the reasons why doctors are leaving is due to unpaid administration work. Where's the back office?
Yeah, this is the classic case. It's the same as research. You've got really highly trained scientists who are out washing cars because that's a really useful use of their time. And this is the thing here. You've got doctors, nurses, clinicians throughout the system having to do paperwork because they've taken away the back office because we support. It's just bullshit.
To the police.
And they're paid less than their Australian counterparts.
Yeah.
60%.
I mean, thank goodness we've got a health insurance system where we actually have to sit down there and ring and have some busybody who doesn't know what they're talking about sitting down there and doing it. Let's get for one more, Jenny Markov or Debbie Narua Packer.
Thanks for watching. Make sure you're subscribed to our Facebook, YouTube, Twitch, Instagram, TikTok. Who's got the order, baby?